Hello and welcome. My name's Sam. I'm a physiotherapist in the Sheffield Teaching Hospitals. This talk is about thinking curiously about the puzzle of pain and possibly getting you questioning your current understanding of pain. Scientists are starting to think differently about pain, making exciting discoveries, including that understanding it better can be an important part of the recovery process. For hundreds of years, the belief was that pain was a direct response to damage. You injure yourself and a pain signal is sent directly up to the brain. This idea is still current in many areas of modern society. However, scientists now think that pain is not an accurate measurement of the health of your tissues. Pain is now seen as a protector. As we continue to learn more, we discover pain and tissue damage do not always go together. We're capable of experiencing severe pain out of proportion to an actual injury, for example, a paper cut. We can also be injured without experiencing any pain at all. Have you ever noticed a bruise but not known how you've got it? An example there of damage without pain. And we can even experience pain without any injury. In 1995, the British Medical Journal reported the case of a 29-year-old builder who jumped off a piece of scaffolding onto a 15-centimetre nail. Now, this nail went straight through his steel toe cap boot. As you can imagine, he was in significant pain and required extremely strong pain relief to manage the situation and get him finally into the ambulance. When he arrived at the hospital, the medical team managed to get his boot off and was surprised to find no damage at all. Not a scratch. The nail had gone in between his toes. There was no injury. Now, his pain was real, as all pain always is, yet there was no damage. Now for a quick overview of the biology of pain. I want you to think about walking barefoot over your living room floor. Suddenly you tread on something that you weren't expecting to tread on. Now at this point, very large, incredibly fast, well-insulated nerves are stimulated, and they send information up to the spinal cord. From here, the message is passed up to the brain, providing a location on the body where you were touched. Now the item that you trod on, if it was sufficient enough, let's say something like a Lego brick, then smaller, much slower nerves become activated. Now these nerves are important and they're called nociceptors. Now nociceptors have a high threshold, which means it takes a lot to activate them. They respond to changes in pressure, for example, trapping your finger in a door, or changes in chemical level following inflammation around a joint or a body part, and also changes in temperature after a burn or a scald, for example. And nociceptors, they carry danger messages up to the spinal cord. If the amount of information is sufficient enough, then that message gets passed through and is carried up the spinal cord by other nociceptors to the brain. Now just keep in mind, there is no pain yet, just information, just danger messages from these nociceptors going up to the brain. Your brain then makes sense of these messages based on the information arriving, but also vast amounts of information that was already stored there. Your memories, thoughts about the pain, other thoughts you're having at the time, your feelings, information from other senses, what you can smell, what you can hear, what you can taste, what you can touch. Cultural beliefs, your emotional state, any beliefs you might have about the meaning of pain, family and social support, your home and financial circumstances all come into play. Now, all of these impact on how your brain analyzes the nociceptive information. If your brain judges after considering all this information that the body needs to be protected, then many systems will come together and produce the experience of pain. Pain is always produced by the brain. Now, 6 months after an injury, we know that the body will have healed to the best of its abilities. That's the case for bones, ligaments, tendons, muscles, discs, and most other structures. But pain that continues beyond 6 months there is therefore usually not related to damage in the body. And the reason that pain can persist without damage is down to and due to changes in the nervous system. Now, your nervous system learns to become more efficient and effective at its job, which is to protect you. And one of the ways this happens is through those nociceptors that we were discussing previously. Through repetitive activity, nociceptors adapt to lower the threshold that they become active, making them more sensitive to changes in pressure, chemical levels, or temperature. The signal that they send up to the brain is stronger and fires quicker and more regularly. Other nociceptors in the area that were previously inactive and silent, they get recruited to help increase the efficiency of the system, so more nerves are involved in the process. Over time, the nociceptors can even come to generate their own signals without any reason at all. And those incredibly fast nerves that provide information on location are recruited and repurposed to aid the cause. Now, all of this means that even touch and gentle movement can be seen by the brain as potentially dangerous. This leads to more efficient and amplified danger messages being received. It's like the brain sees the initial information through a magnifying glass. And because of this, it can be confused into thinking that something is dangerous when in fact it's not, and produce pain when there is no damage. Your central nervous system has now become sensitized. The brain is reacting to an increased barrage of information that might not be a true reflection of what's going on in the body. The tissues are no longer the main issue. The oversensitivity of the nervous system is. Your nervous system is now acting like a faulty alarm. Think about a car alarm. It's designed to alert us to any threats, for example, somebody trying to break into your car. Now, sometimes car alarms go off when no one is trying to break in, when a person just brushes past the car, for example, or the wind blows, or a leaf falls onto the windscreen, or a cat walks over the roof, and sometimes for no reason at all. We still react, though, as the threat is real. We jump into action, rush outside, heart racing, adrenaline pumping, to find nothing wrong with the car. Nothing has been damaged, and there's nothing to fix. The alarm is faulty and oversensitive, and it's not useful anymore. Could your nervous system be behaving in a similar way? If your pain increases with just simple movements, sitting or standing for a period of time, or when you're feeling particularly stressed, is it possible that you aren't damaging yourself, but that your nervous system is becoming overly sensitive and is acting like that car alarm? It's no longer useful. In managing persistent or chronic pain, we talk about trying to reduce the sensitivity of the nervous system, using simple, repeated strategies to help retrain the brain. Now, learning about pain is a useful first step, and hopefully today's talk has been a positive step in the right direction for that. Persistent pain is overprotective, and unfortunately it stops you from doing things that are important to you. So maybe next time your pain increases, you could try and pause and step back from the situation that you find yourself in and consider, how dangerous is this really? Is this my sensitive nervous system being overly protective? And could I choose to nudge gently into this discomfort, knowing that I'm not harming myself? Pain is complex. Pain doesn't always mean that you have damaged something. It is possible to find that space to pause and ask yourself, how dangerous is this to me really? And could you choose to nudge into pain, to keep doing some of those important things, maybe important things that you've had to stop doing over the past period of time?